Hi everyone, Dr. Nemechek. I want to touch on Hashimoto's thyroiditis. Okay, so Hashimoto's is a autoimmune disorder, and what that means, autoimmune disorders are where your immune system mistargets tissue in the body. Instead of like fighting bacteria or viruses, it'll attack certain areas of the body, like rheumatoid arthritis is in the joints, Crohn's is mostly in the small intestine, and Hashimoto's thyroiditis is in the thyroid gland. Okay, and the general thinking about autoimmune disorders is that they are, so you have this genetic predisposition, and if inflammation rises high enough, imagine you've got this gene, it boom, flips it into the on position, and that's how you get an autoimmune disorder. And they've shown for the five biggies: psoriasis, rheumatoid, Crohn's, ulcerative colitis, and ankylosing spondylitis, that the vagus nerve, which regulates inflammation, has to fail before you get those autoimmune disorders. So what happens is you start getting some inflammation. That inflammation disrupts autonomic functioning in the vagus nerve, controlling inflammation correctly. When that happens, your inflammation can really jump, and it's capable now of triggering these genes. Now, what happens is when you lower the inflammation, you can turn the genes off. And we've seen this a couple times with ankylosing spondylitis. I've seen this many times with Hashimoto's. Okay, and what the basic story is: patients come here, and it started. They came here they had some autonomic, brain injury and autonomic dysfunction, and so we're putting them on the protocol to try to get neurological recovery. And again, the protocol is fish oil, olive oil, the rifaximin or the brand name Xifaxan, and then daily vagus nerve stimulation. We put them on that. We're seeing the neurological recovery, and then the patient will start saying, "Hey, I went and saw my endocrinologist, and they said I don't need so much thyroid hormone for some reason. They've cut me down." And then, and I've learned to ask now, "What about the Hashimoto antibody levels?" And they say, "Oh, they're coming down." And we've had many patients where they say, "I'm off all the thyroid hormone, and my autoimmune antibodies are zero. Went away, stops." Okay, lowering inflammation will do, so we know increasing elevation turns it on, and lowering elevation could turn off these disorders. All right, and it happens quite a bit. And people say, "Well, the thyroid's damaged, it can't." The thyroid has a tremendous capacity to recover and grow. When you see some people with goiters, they get these gigantic thyroids. Okay, so the thyroid can grow and recover, and we see it all the time. So and again, you can easily treat that, but what it also represents is you have this underlying inflammation, and that inflammation can trigger, it triggers 80+% of cancers, diabetes, heart attacks, strokes, it drives Alzheimer's, attention deficit disorder, chronic depression, all of it. So just take a thyroid can help kind of that little issue, but the driving inflammation that's behind it, that's still going to rip you apart. You got to focus on that inflammation. Hope that's helpful for everybody. Take care. Bye.